Have you ever heard someone say, I'm going for an operation tomorrow, while a different person says, I have a surgery scheduled? Both sound the same, right? But here's the twist, they are not exactly identical. In fact, using one word instead of the other can actually reveal how you understand medicine and even how doctors think. So, what is the real difference between a surgery and an operation? Let's dissect this. No scalpel needed for that. In everyday conversation, people use surgery and operation interchangeably, and most of the time that is perfectly okay. But in medical language, there is a subtle and quite fascinating difference. Think of it like this: operation is the event, surgery is the procedure. That didn't really help, did it? You must be still confused. Let's break it down further. When doctors say the operation went well, they are referring to the whole process from anesthesia to recovery. It's the complete event where a surgical act takes place. It includes the pre-operative period, the actual surgical work, and the post-operative monitoring. So, in simple terms, an operation is what happens to the patient. Now, surgery is the technique or art of performing the procedure itself. When a surgeon says, I performed a laparoscopic surgery, they are talking about the method, the specific type of surgical work done to treat the patient. Surgery is the craft. Operation is the entire event where that craft is used. Or think of it like this if you're still confused, which is quite understandable. A chef prepares a meal. The chef's cooking is like surgery, and the meal served is the operation. Let's take an example. A patient with a deviated nasal septum might undergo septoplasty surgery. That specific procedure, septoplasty, is the surgery. But when the patient says, I had an operation last week, they are referring to the entire event that included getting admitted, being taken to the operation theatre, fasting before the surgery, getting the anesthesia, the surgery itself, the post-operative monitoring period, the recovering from the surgery. Same hospital, same doctor, but two different lenses of meaning. Interestingly, the difference also lies in who is speaking. Doctors usually say perform surgery because they are referring to the professional act they do. Basically, surgeons say perform surgery. Patients and families often say, I'm going to undergo an operation because they experience the entire event: anesthesia, surgery, recovery. So next time you hear someone say, I'm going in for a surgery, you'll know that that person probably is the surgeon. And you would also know what they really mean. So, have you ever had an operation or have you ever undergone a surgery? Tell me which word you usually use in the comments. Another point that I want to illustrate, especially for the medical students out there, surgery refers to the subject, whereas operation is one event that involves a person going into the theatre, which is called an operation theatre, not a surgical theatre. And once a patient goes into the operation theatre, it's not just the surgery that is happening. It's not just the act of making an incision, dissecting, removing something, and then stitching the patient up. But there's also anesthesia. There is also the post-operative recovery. So the entire event is operation, and surgery is the subject which teaches us how to perform these procedures and take care of our patients. Thank you for watching this video. I hope this cleared it up.